Okay, time for the hip joint.
I'm going to show you how to scan the hip joint. So the patient position is going to be supine. The landmark is going to be the femur. The orientation of the probe is going to be short axis or cross section on the femur. And then the movements of the probe are going to be towards the head. So we're going to slide the probe away from the curved portion of the femur. As soon as the femur starts to flatten out, we're going to angle the medial side of the probe up towards the umbilicus. And then make some slight angulations of the probe to make sure that we have the femoral head and the femoral neck that are nice and bright. And you can very clearly see how the femoral head is high on one side of the screen and then drops down to the femoral neck. And the area of interest is going to be the capsular ligaments that sit on top. For an injection, for example, we're going to land our needle right here at the junction between the femoral head and the femoral neck. And that's how we scan the hip joint.
Okay, now, now to draw it. All right, bone. Well, we know that this is bone. And over here, just barely, we can kind of make out a bit of the acetabulum. Okay, cartilage. Well, this is the hyaline articular cartilage of the femoral head coming down to about there. Fluid. Well, we know that fluid is going to live inside the hip joint capsule, touching the articular cartilage. Ligament. Well, what connects bone to bone is ligament. So this is all ligament, and it comes down to about here, something like that. Tendon, we don't have any tendon in this view. However, this is all muscle sitting up top here. Well, a few different muscles, but you get the point. All right, time to move on, or time to do it again. So here's bone, a bit of bone here. Cartilage, well, actually I should draw in the articular or the fibrocartilage of the labrum, along with the hyaline cartilage of the femoral head. Fluid, well, we know fluid lives on the articular cartilage. Ligament, well, what connects bone to bone is going to be ligament. It comes down to about there. Tendon, well, there's no real tendon in view here, but this is all muscle. Okay, time to clear that away and see what it's like in a live patient.
I'm going to show you how to scan and inject a hip joint. The most important thing is to have your patient supine with the leg in a naturally lying position. We don't need to worry about internal or external rotation just yet. The next most important thing is I need to be able to see the anterior superior iliac spine completely exposed from the bottom up. So you need to ask your patient's help. Dr. Del Duca, could you help me expose this part of your leg all the way up to the ASIS? Very good. And lots of times just get your patient to help you by holding the shorts this way and relax back. I can now see my ASIS. I can now begin the procedure. A little bit of gel here. My landmark is going to be the femur. The orientation of the probe is going to be short axis on the femur. I'm now going to slide the probe proximally until I see the femur start to flatten out a bit, like so. And then I angle the probe just slightly, the medial edge of the probe just slightly towards the pubic symphysis. And I can now see the curved head of the femur here. And the target for injection is going to be where the femoral head drops off. It's called the head-neck junction. My needle angle of entry is going to be right about here, in plane with the probe, dropping it right down to where the yellow needle tip is. The needle, forgive me, the yellow arrow tip. So that's how I scan and inject the hip joint.
Okay, now time for the quiz. Hey, congrats on finishing that section. Can I show you inside one of our live courses? Let's go.
I certainly can say that Frank's courses are very well structured, very well taught, very practical.
Just even being able to use ultrasound in like the top 25 conditions are the ones that we see in clinic.
There's a huge community and a huge well of knowledge when you join one of the courses and you have access to all of these people who have seen a lot more than you have, and there's no guesswork. You leave feeling very confident with what you need to do to be successful for your patients and then in your practice.
You want to be able to do basic hip injections, shoulder injections, elbow injections, and I think Frank Johnson set up a very good protocol and a very good syllabus to be able to get the top type of procedures you're going to be doing in clinic and make sure you understand those well before moving on to the next step.
My revenue went up almost instantly. There's always now just more opportunity to reinvest into my clinic, reinvest into the things that I like, and I've been very satisfied.